The Tom Woods Show, episode 1652.
Prepare to set fire to the index card of allowable opinion. Your daily dose of liberty education starts here. The Tom Woods Show.
Folks, if you're like me, when you criticize the Federal Reserve, you get all these lackey-style responses. Why, the Fed has made the economy more stable. You don't want to go back to the 19th century, do you? All kinds of arguments like that. Well, you can blow those and others out of the water with my free ebook, Our Enemy, the Fed. Grab it at ourenemythefed.com. Hey, everybody, Tom Woods here. David Stockman's back with us today, so you are in for a treat. You'll recall David Stockman was the director of the Office of Management and Budget under Ronald Reagan from 1981 to 1985. Before that, he was a U.S. congressman from Michigan. He's the author of numerous very, very good and helpful books, my favorite of which is The Great Deformation, The Corruption of Capitalism in America. Fantastic book. He is the publisher of David Stockman's Contra Corner, which is my go-to site these days, David Stockman's ContraCorner.com. I highly, highly recommend for just the depth of the analysis. You're just not going to find it anywhere else. You're not going to find somebody who does that kind of research and puts it right at your fingertips. And we want to talk about the topic of the day, which, yes, it's still the virus, but it's also the economic ramifications and the strategy that's being followed. And David has been second to none on this. David, welcome back.
Great to be with you.
David, I actually joined David Stockman's Contra Corner not too long ago because I just had to get your writing. I had to read it regularly, not just the occasional one that makes it out to the public, but I had to read you because what I was seeing proved to me what I was already suspecting, namely that you were probably doing the best work on this. And you have got facts and figures coming out the wazoo. So what I like about your pieces is that they're not just somebody bloviating. There's some really, really good facts and figures behind it. And you say in a column that you actually emailed to me today, but you didn't realize that I'm already a subscriber of David Stockman's Contra Corner. You're talking about how they've wiped out all the jobs created in the entire 21st century. They've all been wiped out. How many jobs is that?
Well, it's actually astounding. If you look at the number reported for April, 130 million payroll jobs, that wiped out 20 million jobs, all the jobs that have been created, not just since the Great Recession, but actually since January 2000, the entirety of all the new jobs generated by the American economy in this entire century. And of course, that's for the labor market overall. If you look at the heart of where shutdown nation has decimated the economy, and that's what I call in the social congregation area, leisure and hospitality, restaurants, bars, and so forth, the numbers are truly out of this world. In that sector, there were 17 million people employed in February in hotels, bars, restaurants, ballparks, and the rest of the leisure and hospitality complex. 8.5 million of those jobs have been wiped out in 2 months. And if you look at it correctly, which I like to point out, it's not just the jobs count, but really the hours on the clock. I mean, that's what people get paid for. That's what they have to, support their families and pay their bills with. The hours on the clock in the huge hospitality and leisure sector of the American economy have been wiped out all the way back to November 1979. 41 years worth of job growth in that entire sector of the economy was wiped out by these stay-at-home shutdown orders that were issued left and right by the governors and the mayors once the White House gave the green light and declared a national emergency on March 13th. You know, the CDC puts out a wealth of data on this. The so-called with COVID deaths, I think, are inflated because They're now coding anything. People that have multiple illnesses, you can go in 95 years old, the victim of an auto accident, dead on arrival, and they'll test you for COVID afterwards. And if it's positive, it gets added to the numbers. Now, I'm not making light of this, but I'm saying the data they're reporting is the worst case. It's deliberately inflated because that supports the whole massive intrusion that lockdown nation involves. But nevertheless, if you take their numbers, they break them out by age, they break them out by health condition, and it's clear that this is not as I like to say, it is, not a random sample grim reaper. COVID is like a really nasty bully that attacks the aged, the infirm, and the already medically afflicted with very serious diseases. And I think one evidence for that is if you take their numbers through April or May 2nd, so that's very current. It covers everything practically up to the moment. There have only been 79 with COVID deaths among the 104 million people in what I call, the school age nation, 24 or under. That's just not to make light of anybody's death. That's a rounding error in the scheme of things. You shouldn't be shutting down the schools. You shouldn't be, telling all these young people you can't go to work or you can't go to the mall or you can't go to a restaurant or bar. That's the first point. The second point is if you take what I call the parents and workers nation, there's 171 million people from 24 to 65 who basically make our economy and society go. They do the work, they do the spending, they do the investing for the most part, they do the shopping for sure. The death rate per 100,000 is 7. Now, again, not to make light of deaths, but the with COVID inflated death rate is 7 per 100,000. And actually, the annual so-called mortality rate for that population is about 600 per 100,000. So we're talking about hardly 1%. And then that gets us to the 52 million people 65 and over, and especially the 6 million people 85 and over. And that's where all the unfortunate loss of life has occurred, 85% of it actually. For that group, the mortality rate is nearly 100 per 100,000. And for the 85 and over, which accounts for more than a third of all the deaths, it's 300 per 100,000 and over. So, we should have been targeting the elderly, the infirm, the already medically afflicted, the population and assisted living centers and nursing homes or even retirement communities, because that's where this so-called Grim Reaper struck. And we shouldn't have been shutting down the whole economy and causing an absolute economic disaster that is going to be very hard to reverse, given another theme we have, and I know you talk about it a lot as well, and that is this wasn't a booming, healthy economy that had, let's call it, strong economic immunities. This was a debt-afflicted, economy that was just waiting for some kind of black swan to come along and knock the props out from under this fake debt-fueled, money-printing-fueled bubble that's been developing over the last 30 years. And so, we have the worst of all worlds. We have a government that's now been unleashed to intrude into economic and daily life like never before. I noticed yesterday the governor of Illinois, who wants to keep the state locked down through June, said that it's illegal for more than 2 people to be in a boat on Lake Michigan, let's say, no matter how big the boat and no matter how large the family. I mean, this is crazy when you consider the fact that in Illinois, 50% of all the so-called with COVID deaths in his state have been in nursing home and assisted living centers that, for the most part, are not out boating on Lake Michigan or any of the inland lakes in the state. I only use that as an example because the whole regime of stay-at-home is absurd.
Can I give you another couple examples? I just saw the other day that in New York State, Cuomo is going to be allowing the resumption of, this is not a joke, drive-in theaters. Drive-in theaters you couldn't go to. There's no possible way. You're not going to get the virus at a drive-in theater. And then also you can play tennis again.
Yeah.
Because tennis, of course, we all know the doctors are all telling us that's a major transmission vector. And then I think my personal favorite so far has been, I believe it was the governor of New Jersey, urging people to social distance even at home with their own family members.
Yeah.
If there's one solitary person, even a blue check on Twitter who went along with that, I'd like to meet that person.
Yeah. Tom, you're right on that. And frankly, this whole medical establishment, I call it the WHO, CDC, Infectious Disease Institute, where Fauci came from, and it's all funded in many different channels with the Gates Foundation money. As you know, he's some kind of vaccination fanatic who unfortunately broke no interference in getting there. And so he has not the slightest clue that there's such a thing as individual liberty, a constitution, and severe limits, or there should be, on how the government, bosses us around from day to day. But in any event, it has so intimidated the country just almost overnight. And frankly, when Trump threw in the towel in mid-March, I think it was all over except the shouting, because that opened the door for, power-seeking bureaucrats and politicians, and especially state governors and city mayors in blue states and blue cities to go to town on the economy, knowing, one, Congress would bail them out fiscally if they shut down their own economies and revenue sources, which is what all the push is now. But secondly, if they destroyed the economy, the one thing that Trump had to brag about would be taken off the table. Now, I'm not saying Governor Cuomo and Pritzker and the rest of the nutcases out there are thinking about this explicitly, but it's not too far back in the inner recesses of their mind, because this is just completely irrational. Now, this means that the reign of hysteria, I think, is close to the Salem witch trials of 1692 in terms of how utterly irrational and extreme it's become. But even when you have states like Georgia that want to do the right thing, Governor Kemp, or the state of Florida, which allowed its cities to open, and I'm going to one of your examples, Jacksonville opened their beaches, but one, you can't bring any beach chairs or umbrellas or anything like that to the beach. Second, don't bring your barbecue equipment. Third, don't sit down on the sand. You can go to the beach as long as, one, you go in the water, or two, you keep moving. Now, what kind of insanity is this? The people in the category of aged and infirm, for the most part, aren't going to the beach, and they shouldn't. And there's plenty of information out now that tells them they're the ones in harm's way, and they're the ones that need to take ultra precautions. But if you are going to have 24-year-olds going to the beach, and the death rate is a fraction of 1/10 of 100,000. I mean, what kind of nonsense is this? But this is how far it's gone, and this is how deep the intimidation has become, because even a city like Jacksonville that lives from the beaches and the whole, hospitality, leisure, tourism thing that it generates, is afraid to open its own beaches. for fear that CNN will go after them, for allegedly jeopardizing the nation or some crazy thing like that.
Well, let me ask you, I'm going to disclose this, anyone could find this out. You're 73.
Right.
Are you taking any precautions related to this?
Yeah, because actually, I have a compromised immune system. I had chemotherapy, pretty heavy-duty chemotherapy, a few years ago. So I'm reading the evidence, and it says someone like me is at heightened risk. And it's me that should be quarantining myself. So I am doing that. But I shouldn't be, or the government shouldn't be imposing that same level of protection on people that are not at risk at all. And frankly,
right. Now I hear that, but let me play devil's advocate here, because they could say you, as a robust 20-year-old, may not indeed be at very high risk or really any risk at all, but everybody, almost everybody, knows, interacts with, or loves somebody who is vulnerable. And if you have any contact with them, you could unwittingly pass it on to them. So in that sense, we are all in this together, that it's not just your health, it's that you could pass it on to somebody who is vulnerable. That's why we all need to stay locked down. How do you answer that?
Well, I think it's the wrong quarantine. In other words, I need to steer clear of most other people who may or may not be, asymptomatic carriers. But that doesn't mean that people that I see walking up and down the sidewalk here in Greenwich who are 30 years old need to be kept out of the stores or the restaurants or the gyms or wherever else they want to go. There is such a thing as herd immunity. It's impossible to stop a virus like this. And there's a whole school of epidemiologists and virology experts who say this is, ass backwards. You want to promote the most rapid spread of this through the population possible, because people will develop immunity once they've had a mild case, and 90%, 95% of people who are infected either are asymptomatic or have a mild case, except again, the very elderly, frail, and medically afflicted categories. And so that's what you want to happen. Now, more or less, they've done this in Sweden. They haven't closed down the economy. Schools through, age 16, and restaurants are open, stores are open. The business, for the most part, is working. And they've had pretty good success because, one, the virus is spread through the population and herd immunity is clearly developed. Their caseload and their death rates are far lower, actually, than in most of Europe that's been hard hit, like France, England, Italy, and so forth. And I think they've made the right decision, and they're not going to pay even remotely close to the economic price that's going to be paid here.
The impression we get listening to people who support the shutdown is that the economy is like a machine with an on-off switch. We can just turn it off for a little while, and then when we say things are better, we can flip it back on. Now, of course, they're going to say it's a gradual reopening, but still conceptually, they're thinking of the economy as something that won't really suffer if we just turn off bits and pieces of it for a while. We just turn it back on and we go back to normal. Is there anything wrong with that?
It's totally wrong, but it's especially wrong given the economic and financial context we're in. If we had an economy with a traditional debt to GDP ratio of 1.5, and therefore we had about 30 trillion of debt, it would be one thing. But we have an economy with 75 trillion of debt, public and private, and the government sector is clearly drowning in debt. But corporate debt is at 15, or business debt is at 15.5 trillion. Off the charts compared to anything historically or compared to cash flow. Household debt is nearly 16 trillion. There was no deleveraging that happened after the wake-up call in 2008. So if you have that kind of economy being shut down on a dime because of this, hysteria about COVID-19, then there's going to be a lot of broken furniture unless everyone is held harmless with 100% of their wages, because 80% of households, don't have any rainy day savings, or if you're a business, through the multiplicity of programs they've now put in place, you've had your cash flow supplied by the small business PPP program or all the other alphabet soup that the Treasury and the Fed are launching. Now, what's wrong with that? Well, the answer is it's just drowning the economy even beyond where we were when this struck. And it's all being financed by the printing press at the Fed. I mean, these are really crazy numbers going on. This year, even with what they've passed already, the federal government's going to spend $7 trillion. Revenues are plunging. Down 50% in April compared to last year. Lucky to get $3 trillion. We're going to borrow $4 trillion this year, $2.5 next year, and so forth. And the Fed is in there buying up everything that's being issued hand over fist, not only by the government sector, but by business sector already. The business sector is already issued over $1 trillion of new debt this year, and we're only early May, and that's as much as the entirety of last year, which was a record. Now, how do you think about that? The economy shut down, cash flow shut down, earnings have vaporized, and we're now having government debt issuance and corporate debt issuance that is, multiples of anything that's ever been imagined before. So, you could say that you can turn the switch on and off, but the only thing they've done is turn the switch at the Fed on to, hyperdrive. And, it's really uncharted water as to where we're going.
I've been trying to think of how we emerge from this. What are the different scenarios? Well, in fact, I'm going to lay this out in just a minute after we have a brief message from our sponsor. Hey, everybody, my daughter Veronica is with me today. I've been telling you guys about Skillshare for a long time. One membership gets you access to thousands and thousands of classes. These are classes that can make you a more attractive employee because you have more skills. It can give you a skill that can help you start a business even. And it can also just help you cultivate a hobby more enjoyably. And I want to talk to Veronica about a few classes she's been taking. Now, Veronica, how old are you?
15.
All right, obviously that was just for the sake of the folks. I do know my own daughter's age. Tell me what classes you've been taking at Skillshare.
Mainly art and a bit of sewing. So I did anatomy for the art and then the art of doodling. And then for the sewing, it was how to sew a circle skirt.
And about how long are these classes?
Some are 30 minutes, some are an hour, some can go on for a little longer.
Would you say these classes were a good use of your time, that you learned something valuable from them?
Yes, because with the art of doodling, it helped me how to, get creative with the things that I had or with certain themes. And then for the sewing, I can now picture in my head what I want it to look like and execute it better than what I was doing before.
Thank you, Veronica. Well, folks, Skillshare is running an amazing offer for our listeners. Get 2 months of Skillshare for free. That's access to thousands and thousands of classes for free for 2 months. To cash in on that amazing offer, head over to Skillshare.com/woods right now. That's Skillshare.com/woods. I've been trying to think of how we emerge from this. What are the different scenarios? Now, I told you before we started recording that I've been a real travel fiend lately. The past year, I went on so many trips, and then suddenly, they just got done telling us how great globalism is, and then I'm convinced of it, and now they won't let me go anywhere. But there are a couple of places where I think it might be possible for a travel addict like me still to go. One of them's Iceland.
Yeah.
They haven't had a death in 3.5 weeks. They've had 10 deaths total. If you look at their curve, it's like they have almost no new cases per day. I think they're going to reopen to tourists. Their attitude is the tourists tend to stay among themselves, so we don't really worry about them. And we're Iceland. Yeah. What are we going to do without tourists? So there's that. The other one is Switzerland. The other day, they actually accelerated their reopening. They're opening all kinds of things, and they're saying because we need to learn to live with the virus, interestingly enough. So that's something that there will be countries that will open up, and we'll see what happens. But I think the best hope is that in the U.S., you do get some governors that say the correct metric is not number of cases, but rather hospitalizations, hospital strain, whatever. If you really want to keep an eye on something, that's the thing to keep an eye on. And we shelter vulnerable populations. But there'll be some states that open with just the other day, Georgia reported like their best day yet in terms of all the relevant metrics. And there will be, I don't care how blue of a blue check you are going to be going crazy when your kids can't do anything. They're all depressed and demoralized. Everything they had going this year has been ruined. And I know you're going to pretend this is all to save lives, but in your heart of hearts, you have to know at some point, I have to up and move. I mean, I think it's quite possible if this state goes on much longer, I think a non-trivial number of people will vote with their feet. And that will be one way we get out of this. What do you think?
Yeah, I think that's true. And that's why this whole notion that's been long dormant, going all the way back to Louis Brandeis, that the states are a laboratory of democracy and experimentation, different solutions for perceived problems is exactly what we need at the moment. Because frankly, when these states and localities start opening up and, Armageddon doesn't happen, it's going to become pretty obvious that the hysteria was way, way, way overdone. Because, one of the key facts to take away from this is the mortality rates for COVID-19, if you actually measure the right denominator, which is everybody who's been infected, not just the people who've taken tests, because that's a self-selected population. They've gone to the hospital, they're sick. They're giving everybody a test. They're feeling symptoms or are symptomatic. They call the doctor, they get a test. They're worried, they get a test. But that's a very small fraction of what we now know from many antibody studies that have been done, California, even the state of New York, that, somewhere between 5 and 20% of the population everywhere, from California to New York, has already been infected, probably has the antibodies, which means that the mortality rate measured against everybody who was infected is probably 0.2, 0.3%. And that's not much higher than the normal seasonal influenzas and pneumonias that develop year in and year out. Now, I'm not making light of COVID-19, but I think the evidence from around the world, you cited Iceland, South Korea's got the same numbers. Japan has the, very, very low numbers, like their death rate is 2,000 per 100,000. South Korea, I think, is 1. Iceland is like 10 people, which doesn't even, factor into the normal mortality equation. So I think it's going to become pretty evident that, one, this is pretty infectious, like some flus are. Secondly, the mortality rate is extremely low. It's unfortunate, but low. And third, it is unusually targeted on the oldest and weakest part of the population, which gives you a roadmap on what to do. Take the case of New York. This is becoming a real scandal. And, I'm glad that Fox, Tucker Carlson is on it. And when he goes after something, he goes. They actually, in New York, made a mistake for the death there in long-term care and nursing homes when they ordered in, March 17th, long-term care facilities to take positively testing COVID patients in order to, reduce the census in the hospitals. And they put them in these nursing homes, and it spread like wildfire, which is exactly what you might expect among a highly vulnerable population. The average age in nursing homes is 84 or something like that. That's what triggered the huge surge of deaths that occurred in New York. And New York and New Jersey account for almost half of all the COVID deaths in the United States. So when we look at all of this, all of the data, when we understand that in a free society, just don't shut down the entire economy and social life at the whim of some 79-year-old doctor. And let me just go after Dr. Fauci and the scarf lady for a second, Deborah Birx. Neither one of them has ever had an honest job in the private sector in their entire life. Now, this is important to understand. Fauci graduated from Cornell Medical School in 1966, went to work as a researcher at the Infectious Disease Institute, and has been in the same dark tunnel for the last 52 years, including as director since 1984. The scarf lady, as I call her, went to work for the U.S. government and never left. Now, between them, I think they have something like 85 years of on the government payroll, and they have no clue on how the real economy works, that there isn't a light switch, an on and off switch, as you say, and that they didn't even begin to weigh the cost and benefits and also the medical and health effects of shutting down the economy, throwing 20 million people out of work, already 30 million really, when the data catches up that we can see from the unemployment claims. This is a, case of government overreach like I don't think we've ever had in this country, even during the worst times of FDR in the 1930s.
Not only have we not have it, I don't think we could have conceived of it.
Yeah. And also, it happened with lightning speed. If you just go back and look, the first COVID-19 death reported in the country, I think, was February 26th. There was a lot of harassment of Trump coming from, the usual mainstream media and Democrat sources in late February, early March. And then this ridiculous study came out of Imperial College in London, the so-called Ferguson study, that predicted 2.2 million deaths without social distancing and lockdown and stay at home. And Trump, unfortunately, and like in so many other cases, was home alone in the White House. He doesn't have any competent people who understand, what government should do and not do. And they scared the hell out of him with these forecasts. They brought in Fauci, who's, more or less a creature of the swamp, as well as the scarf lady, and spoon-fed him a diet of fear for a few days, and he signed off on the National Emergency Declaration and these ridiculous CDC guidelines that instantly opened the door to Governor Cuomo, Governor Pritzker, all the rest of them, the governor of California, to trigger these forced lockdown measures. It happened, practically overnight. And then CNN took over with their, banner running across the bottom of the screen, updating the number of deaths per hour, as if, totally out of context. As if deaths don't happen. Well, 8,000 people die in America every day, unfortunately, but that happens in a population of our size and demographics. And no effort was ever made to put this in context or to understand how it's happening. It was just one massive campaign of fear and hysteria that, hit the country like a tornado in a very short period of time.
Well, one of the ways to keep sane here is to read David Stockman in these dark times, because it's hard to find the kind of analysis you're giving, even though it's just seems like common sense, but man, have you gathered the data. And that's over at davidstockmanscontracorner.com. And if that's too much of a mouthful and you're driving around, remember, I'll link to it on our show notes page. This is episode 1652. So it'll be tomwoods.com/1652. Thank you for being a truth teller in these dark times, David Stockman.
Great to be with you.
All right, folks, I have a free resource for you that's going to be helpful if, well, you're a human being and you're alive. It's called peaceofmindprepared.com, created by a Tom Woods Show listener. And it covers topics like strengthening your immune system, physical fitness, growing food, food and water storage, evacuation planning, job loss preparedness, COVID-19, contentment in adversity, and a lot more. There's a free ebook there to help you quickly get more prepared, a podcast as well, wonderful resources there for these times in which we're living. So check out peaceofmindprepared.com, and you are checking out material by a fellow listener. I'll link to this site at tomwoods.com/1652. And if you would like to get a shout out for the website that you've not yet created, but someday will, go check out tomwoods.com/publicity and find out how you can get a boatload of free targeted traffic from the old man here. Very, very easily done. tomwoods.com/publicity. Tomorrow we are talking economic history, American economic history, with our old friend Jeff Herbner. I'll see you then.
Become a smarter libertarian in just 30 minutes a day. Visit tomwoods.com to subscribe to the show for free, and we'll see you next time.
Like the sound of the Tom Woods Show? My audio production is provided by Podsworth Media. Check them out at podsworth.com.